So good evening to one and all. I am Dr. Prashant Devkare from the Medical Affairs team, Sun Pharma. It gives me immense pleasure to extend to you all a very warm welcome on behalf of Sun Pharma. In our fight against pandemic, doctors and healthcare professionals have been lifeline to many. Their service, despite the risk to their health and the safety of loved ones, is an inspiration to all. On 1st July 2021, as India celebrated Doctors' Day, Sun family launched Sankalp, an initiative for the welfare of doctors, their families, and communities at large. Sankalp is a tribute to these heroes for their selfless act of sacrifice and kindness. To know more about this initiative, we would take you all through a small video. Support team, can you please play the video?
Oxygen levels are dropping drastically. Patient coming in 40 years old with 100 degrees.
Who is she?
My wife.
Mom, my best friend.
My guide.
My daughter-in-law.
My child.
A doctor's smile sparks off 100 smiles. And as a promise to keep their smiles going, this Doctor's Day, Sun Pharma is proud to introduce Sankalp, an initiative dedicated to doctors, donation of COVID-19 medicines, educational aid for doctors' children, postdoctorate educational sponsorship, mental health support for doctors. Sun Pharma, reaching people, touching lives.
So welcome back once again. So under this initiative, we have already started with the mental health webinars for doctors and their families. So in short about these webinars, a series of webinars have been planned to educate the clinicians and their families who are associated with COVID duties. These sessions will include real-life cases and offer practical tips for their well-being, which would enable them to take a better self-care and provide effective patient care. The speakers for these sessions are experts from the field of national disasters like earthquakes, cyclone, droughts, and more importantly, COVID-19. So to know more about this webinars and also the mental health counseling, please, I would like everyone to please visit our website, that is sunpharmasankalp.com. So after this, now we move on to our today's session. So today's topic for the webinar is COVID, grief and trauma. And I am very much fortunate to introduce our guest speaker, who is a renowned psychiatrist with extensive experience in the field of mental health, Dr. Suresh Bada Math. So he has completed his MBBS from KIMS Hubli in 1998. He has done his MD Psychiatry from NIMS in 2001. He has continued his academic career and earned various degrees such as DNB in Psychiatry, postgraduate diploma in Medical Ethics and Law, and in Human Rights and Law. He has also did his PhD in Law from the National Law School of India, University, Bangalore. So currently he is a professor of psychiatry and head of forensic psychiatric unit and head of telemedicine center, and also a consultant of community psychiatry at NIMHANS, Bangalore. His keen interest in research had led him to be investigators in various research products, which is depicted through his 330 publications in national and international journals, including 11 books. So recognizing his contribution, the Indian Psychiatry Society has honored him with Professor Raghuram's Distinguished Young Teacher Award in the 25th National Conference Indian Psychiatry Society, which was held in 2015. He has also won Dr. C.V. Raman Young Scientist Award in the medical field for the year 2015 and 16 by the government of Karnataka. So now, before starting the session, I would request everyone who are having any questions to please type in their questions in the chat box. So now over to you, sir. So you can share your slides and enlighten us.
Thank you, Dr. Prashant, for the wonderful introduction.
Thank you. So I'll be sharing my slides now. Before I start my presentation, I would like to thank the Sun Pharmaceuticals for giving this wonderful opportunity to share the experiences, what we have learned in the disaster. I had personally worked in tsunami and also in Uttarakhand flash floods. So along with this now, of course, with the COVID. So before I start, I would like to place my disclaimer. This presentation is for academic and training purpose. For clinical opinion, please do contact a psychiatrist. Conflict of interest, none. So in this today's discussion, I'll be discussing on COVID grief and trauma and how to tackle this grief and trauma. So these are the two simple objectives I have kept and see how we can deal this situation. And before I move further, I would like to thank all the doctors who have been working hard since past almost 1.5 years. Usually we see disasters like tsunami or else maybe flash floods. The disaster is located to a very small geographical area. But in COVID, it's the entire globe has been involved. So there is nothing called a survivor and the service provider. Everyone is a victim here. So in this background, we will discuss this. First case, Vignette. I have changed some of the information in this. Dr. R, she is a physician, aged 36-year-old, working in a public sector. In the first wave, her father got infected with COVID. She wanted to go home and take care of him. She lives in a different city along with her husband. But she was posted in the duty and she could not go. And she even requested for a leave. It was rejected because she came to know her father was admitted in the ICU, but she could not make it there. Within 6 days after the admission, the father expired. And of course, in the first wave, the way you know, the cremation was done with a very strict protocol. And the cremation occurred before she could reach and meet her father. That is, before she reached the hometown. So the doctors working in the hospital told that her father was asking her whether she came. So hearing this, she broke down. After a week, she started to feel her father is alive and he will be visiting her. She refused to believe her father has died. She hears her father calling her, talking to her. Now she's not going to work since past 7 months, thinking her father may visit anytime and she should be there at home. She has been suspended from job because she could not go to work in the second wave. She thought her father may come anytime. So this is one of the grief which has hit a lady doctor very badly when her father demised. This is one of the symptom of grief, how it presents itself. This is the first case, Vignette. A second case, Vignette. Dr. A aged 70-year-old family physician, retired from government sector and was a qualified MD doctor, MD medicine, married, and also had a child of 9-year-old. His son died in the COVID second wave. That is basically the elderly senior citizen doctor has a son who died in the second wave because of the COVID. Immediately, his daughter-in-law committed suicide by hanging within next 1 week. Now the child, the granddaughter, she is around 9-year-old, she's staying with the Dr. A, that is the grandfather. Now, in the past 6 weeks, the child is withdrawn, irritable, having clinging behavior, passing urine in the bed, which was dry actually, but enuresis has restarted. At times shouting, food refusal is there. Reporting of death wishes, telling that I would like to go and join my dad and mom. So this senior citizen physician doesn't know how to take care of the granddaughter. So this is another case, Vignette, which we came recently. The last one more case, Vignette. Dr. M, he's an emergency medicine physician, age 30 years old. And in the second wave, when he was doing night duty, Mr. Y, a senior citizen aged 72 years, was brought to the hospital in the night around 1:30 a.m. with oxygen saturation of 88 and restless. And the senior citizen walked into the hospital along with his family members. He was admitted. He was a known case of diabetes, hypertension, and also a long-standing smoker. Considering that he had a lot of high risk factor, he was admitted in the ICU. He was laughing and also talking, and he was restless. But all of a sudden, around 4:35, he started deteriorating. By 5:30 a.m., he expired. Mr. Swi's family member, approximately 15 of them, barged into the hospital, searched specifically for the Dr. M, who was there on the duty, assaulted him. He was injured badly. He was admitted for 2 to 3 days, and he took leave. Dr. M, though he was admitted, unfortunately joined back within 5 days. He went back to work. But now since past 6 weeks, he's having panic attacks. Basically, he becomes breathless, increased respiration, palpitation, sweating, tremor, flashbacks of that he was beaten in the same ICU. And also he started becoming defensive in practice, irritable with the hospital staff, shouting at the nurses, at sometimes patients and patients' family members. Because he's having so much of panic attack, he started using alprazolam. That is, within 6 weeks, he has reached already 4 to 8 mg per day. Recently, around 3 days back, he was brought. He had attempted suicide by taking 60 tablets of Alprax. So here we have seen the doctors, one being the family member who is affected. Second, their grandchildren, that is the third generation, is getting affected. And the third case, Vignette, where the doctor himself was a victim of a violence. So we can see the range of the violence which the doctors are going through. So let's just keep these 3 case vignettes aside. Let's look at the pre-COVID era. That means before the COVID, there around maybe before 2020 January. If you look at the whole country, National Mental Health Survey done by NIMANS Bangalore showed 10% of psychiatric morbidity in general population. 3% were substance dependence, that is alcohol dependence, and also various cannabis, opioid. Dependence means addiction. At the same time, in 2019, 1,39,123 people had committed death by suicide was there. And attempted suicide was 28 lakh. This is the pre-COVID era. Before the COVID date, this is the snapshot of our Indian mental health morbidity. If you look at the doctors, the various study across the globe says anesthetist, there is a increased suicidal rate. The mainly reason being, one is availability of those anesthetic agents for committing suicide. Second is basically they work day in and day out in a very tense moment of providing anesthesia. So they are at the high rate. And if you look at the doctor profession, over a period of time, depression, burnout is very common. And in COVID, it has become universal phenomena. So what will happen? So I gave a snapshot of our country before the COVID. So what will happen in another 4 to 5 years? If you look back, 100 years back, influenza pandemic, that is in 1918, 100 years back, after 5 years of this 1918, during 1925, they found there is a 5 times increase in mental health morbidity. 5 times increase. So if we take the same number here, just to hypothesize, we have 10% now, we are going to have 50%. That is a hypothesis which I am putting across. So with this mental health morbidity, we will now discuss and see what are the problems we are going to face over a period of time. That is, as you know, financial loss, job loss, marriage are breaking, and domestic violence, drug use, non-substance dependence, female children dropout, relationship issues, death of a family member. So all these are seen in our doctors. Why? Because the youngsters who have passed out, They are not getting job. They have taken education loan. They are finding it difficult. Even if they are in the job, sometimes they have been removed from the job or they are unable to cope with the job and they are quitting the job. The reason being is, as you know, MBBS do not prepare them to work in ICU setting. So they have to get post-graduation. That is an unfortunate, but that's the truth. Invariably, marriages are breaking because of various reasons. Domestic violence are increasing. Of course, alcohol use and drug use need not tell. They are huge in number. And slowly, the non-substance dependence, non-substance addiction means pornography addiction, social media addiction, gambling, online gambling. So various things are starting now. So those will increase the mental health morbidity. Now coming to the grief. Somebody has died. So death may end a life, but not necessarily a relationship. In the first case, a young lady doctor lost her father. The life has ended, but the relationship continues to exist. She feels the father is still alive. So what is grief? Grief is an emotional, behavioral, cognitive, and functional response to a loss. Loss can be anything. It can be a death. It can be a loss of a job. It can be even a property loss. Any loss can be considered as a grief. So what are the normal response to grief? So usually grief is universal and normal because everybody will have a loss. It may be even our health may upset. That itself also create a grief. Suppose you have been diagnosed with the diabetes or you have been diagnosed with cancer, immediately the grief strikes. So grief is a normal response to any loss. Each person's response to grief is unique, complex, and personal. It depends upon the individual how he copes with the grief. Dealing with grief differs from person to person. One person may drink alcohol to overcome the grief because his child has died, so he is drinking alcohol. Or else the other person may become withdrawn, may attempt suicide. Again, 2 days back in my OPD, I saw a young girl brought to our OPD telling that her friend committed suicide in the medical college. She is an MBBS student. She committed suicide because her father died because of COVID. So in the whole scenario, what is happening is we so-called healthcare providers, we feel we are in control of our situation. COVID second wave clearly taught us a lesson telling that you are not in control and we are just a service provider. Not more than that, because we felt helpless because we could not get even a bed for our family members. Coming to the grief back, grief resolves on its own. It has a normal course and time frame. Does not require professional help in most of the time. Usually family, friends, and relatives facilitate healing. So we have to encourage the last rites and rituals when the person dies. And we have to tap into the person's individual dealing potentials, how to deal with the grief. So what are the ways a person deals with grief? There are two important things. One is internal factor, one is the external factor. The internal factor is how the doctor's spiritual quotient is, how much he believes in the God or else he believes in a nature, the coping skills. Attachment to the loss. What is his attachment? He believes that he is responsible for the death of his father, or in the first case, she feels she did not go and meet her father, so the father died. If I was there, he would have held on to his life. So feeling of guilt, the attachment to the loss. Or else in the third case, the doctor felt that he has been beaten up for providing services, becoming angry with the loss. Here, the loss of the doctor is a dignity. A dignity loss has occurred in front of his own staff. He was beaten up. So that is the loss here, and it is angry responses there. That is what the sense of responsibility. And if the person or a doctor having pre-existing mental illness, it may be depression, it may be anxiety disorder, it may be phobia, it may be obsessive compulsive disorder, And of course, the spiritual. These forms the internal factor, how strong you are as a doctor, how well you are able to cope. This forms the internal factor. The more the stronger you are, the more you are able to tolerate the distress. Coming to the external factors, the timing of the disaster or the timing of the grief, whether this grief was expected, unexpected, the duration of this stress. Suppose imagine the COVID, the disaster which has, the biological disaster which hit us 1.5 years back, it is continuing and there is no end point can be seen. That means the longer the duration will have, again, the grief will increase. How good is the family and social support? The context of death or loss. So these forms the external factors. So you may not be able to control the external factor, but you can control the internal factor. The external factors is left to the nature. You can call it as a God. Coming to grief counseling. Now we are coming to the second part of my presentation, how we have to provide counseling or how we have to counsel ourselves. Because many a time, if there is a grief, I said 90% will heal on their own. How to facilitate the one's own healing? The person who has given about this grief is Elizabeth Kubler Ross. She is a psychiatrist. She wrote a book on death and dying in 1969, a book which is sold very well, read by everyone. And the oncologist will know about her very well, how a grief is processed when a diagnosis of cancer is made. So in that context, she has done an amazing study and she has able to come up with various stages. Whenever there is a loss or a grief, there are 5 different stages happens. Shock and denial. As soon as you hear your family member has died or expired or something bad has happened, there will be shock. Immediately you will feel shocked, numb, and you deny this can't happen. Within maybe half an hour to 1 hour, there will be anger. Anger against the system or anger against the person who is taking care. For example, in the first case, the lady doctor, when we started therapy, she started becoming angry about her brother who was taking care of the father. She was so angry, she felt his brother is responsible for father's death for not taking him to the hospital at the right time. So that anger starts coming up. Bargaining, okay, I am not responsible, somebody else is responsible, that will. Depression and acceptance. This is the process of grief. But this process cannot be seen as 1, 2, 3, 4, 5. Sometimes anger can come first or sometimes depression. So it can be depending upon the expectation. Like if a person is already expecting Mr. X is going to die, so invariably he may directly go to depression. Now let's understand the timeline. If you look at the x-axis, it is the weeks, first week, second week, the 2 weeks. Emotions on the y-axis. As soon as the information of a bad news is heard, there is a shock, there is a denial, and then the anger hits the roof, and then the bargaining starts, and then depression at the lowest phase, and then the acceptance. This is the normal course. Within 2 weeks, most of us, 80 to 90% recover in grief. 2 weeks. That is the reason, if you look at our own culture in India, if imagine there is a death in a family, in your own family, let us contextualize. Sorry to do this, but to understand, we have to do this. So if there is a death in your family, the first day, second day, or third day, there will be something called as smashana vairagya. There is a philosophical thinking. Oh, what is there in life? I should also die. My dad died or my mother died. So that smashana vairagya will be there and you don't feel like eating. There will be no sleep. You feel completely unable to feel anything. You will not be able to cry also. By 4th or 5th day, you start crying most of the time. And then slowly by 1 week and the second week, you start recovering. That is the time we do rituals. It may be Vaikuntha Samaradhane or it may be even Kailasa Samaradhane. Various rituals are there in various religion and caste. So it is done at the end of second weeks by the time the family is coped. That means they are coming out of it. All of us get together. They do the ritual. As soon as the family member arrives on the ritual, everybody cries and they start laughing. They will have food. Whenever there is a thought of that person, they will cry, but they recover. They go back to work. Their biological function improves. Their sleep improves. Their appetite improves. Everything improves. So this is a normal phase. But unfortunately in COVID, there is no ritual. Ritual means we can't get together for doing the ritual. That is the biggest irony and the problem in our COVID at this point of time, because we are unable to get together to support the family in the grief. So let's understand about complicated grief. This is the normal grief, what we see, but there is an exploding grief when it's all of a sudden somebody has died. Immediately when there is exploding grief, that's what we saw in the third case Vignette, where the 15 family members of that elderly man came and started abusing and beating up the doctor. So that is exploding grief. Absent grief, there is complete absence. So in the first case, the lady did not have a grief at all because she felt father is still alive. That is absent grief. Delayed grief, when the therapy started, the grief started processing occurs. Protracted, it may last longer, more than 1 month. So that is protracted grief. Sometimes you can see oscillating grief depending upon the relationship between the person who has died. So these are the various different types of complicated grief. So the emotions, what we see in grief is confusion, disorientation, sadness, feeling of overwhelmed, shock, anger, detached, numbness. Numbness is one of the criteria which they say in grief over a period of time, it may develop into PTSD or severe depression. So they require medication. So if the person is having numbness for longer duration, they find that yes, that person is going to require professional help. Irritability, frustration, agitation, fear. These are the normal findings we are going to see as an emotion. Cognition, basically thinking process, denial, feeling of helplessness, hopelessness, feeling responsible. I am responsible for my death of my father. I am responsible for not taking my mother at the right time for treatment. So this feeling of guilt is a commonest thing. I had seen in tsunami, I was posted in Andaman Nicobar. I had seen one of the family where the person, they generate electricity on the island of every Andaman Nicobar. There are around 535 and odd islands are there, and they generate electricity at the seashore. And what happened in the early morning of 26th December 2004, when the waves hit, it hit the Andaman electricity board basically because they are all in the seashore. At that time, he saw the wave. A person who is a male ran towards his house. Inside he went, pulled his wife. He had 2 kids and he brought one kid outside. It was early morning, 7 o'clock. The first wave hit. So somehow he was able to balance himself and hold the child. And his wife told there is another child inside who is sleeping. He ran inside and suddenly the second wave hit the house. House was completely collapsed. He lost control of himself. His wife, his 2 children died. So he was brought to the camp, in the relief camp. When I saw him, he was completely numb, complete denial of death. As we started therapy, he had a breakdown. He was doing a completely denial kind of like his wife. He used to say, my children are playing here, my wife is here. But unfortunately, in that whole island, only few people survived. So he was one of them. And once the therapy we started, the problem survivor guilt started. I could not save my 3-year-old child, 7-year-old child. I could not save my wife. So what kind of person I am? So he started degrading himself and even he attempted suicide. So, but we were able to provide therapy and the medication was started. So this kind of survivor guilt is common because we being a doctor, the survivor guilt that I did not take care of my family members. One, the guilt of infecting our staff. I infected my colleague. Because of me, the whole team got infected. If by chance one person dies Imagine you will carry that burden till your grave. So this kind of grief is survivor guilt is very common. And sometimes they think the world is not safe place or a good place. Behavior, suicidal behavior, drug abuse, substance use, breaking COVID protocol, becoming aggressive, avoidance, not going to work. So now let's understand when to seek professional help. See, invariably I said 90% self-healing occurs if there is a good ritual occurs. That means a good letting go occurs. Basically, why do we do this grieving ritual? Basically, everybody joins together and tell the family, yes, that was the time he has gone. You did your best to take care of your family member, your father or your mother. But 10% require support or else professional help. So that's where the issue starts. The people need to take help from the professional if they have a denial of death. That is the first case where the daughter was telling, my father has not died. She requires support. Whenever there is a suicidal ideas, attempts or death, the second child, that is the granddaughter, requires support from a child psychiatrist. Protracted emotional turmoil. That means the person does not go to work and they has been suspended from the work and she is unable to cope. Those people. Poor biological, social, occupational function. That means they have not gone back to the normalcy. Anger, emotional outburst, depression is there. Then yes, they require help. Again, I'll give you the depression is very common symptom. As I said, if there is a death in the family, the first 3 or 4 days, we feel that vairagya, smashana vairagya. If it stays for more than 2 weeks, that is called as depression. Qualitatively, quantitatively, it is more. Then we call it as depression. So that depression, if it is there, please, they require help. Otherwise, we don't know when they will attempt. So we have to provide treatment at the earliest. Now let's understand the COVID grief, how it is unique. Because we are unable to grieve, we are unable to go to the rituals, and death occurs in isolation, and death occurs so rapid, you don't even have time to process because you have to get back to work because your team is calling you, boss, please come back to work. When are you coming back? Rituals are minimal. Unfortunately, social and relatives distancing. Imagine if there is a death, we have seen children, they don't want to come and do the cremation. So many a time in the wards, the doctors were carrying the bodies because nobody was there available for shifting the body. No dignified burial, social stigma and discrimination. I need not tell about the doctors when they went back in the first wave. Many of the localities refused to allow the doctors inside the apartments or into the house or even into the village. So of course, survivor guilt is very high. Of survivor guilt not helping the family, source of infection, I am the reason for causing the death, and various other reasons. So moving further, coming to the last part of my presentation, grief counseling steps. This is, we have to know for ourselves because invariably, many a time if you tell your colleague you need to seek help, they will not take help. The reason being they refuse. Why should I go and meet a psychiatrist? Why should I meet a mental health professional? Very difficult people to treat are the doctors. The reason being is they have their own thinking process. You give them antibiotics, they will take only for 2 days. You give medicine, they have their own thinking process. They will not complete the course. Very few doctors I've seen who take the medicine as prescribed by their physician. So it's a very difficult preposition to treat a doctor. So moving further, first and the foremost is rapport is essential. If you know your colleague is going through a grief situation, somebody has died in his family, or something big loss has occurred in the family, talk to them. That is the best way because you are also a service provider. A psychiatrist cannot come and talk to them. And if you tell them to go to a psychiatrist, you are adding for the grief, most probably. Because how can you tell to go and meet a psychiatrist? The fight may resume. So if you know them, talk to them. If you don't know them, ask about what is your name. I came to know that you are from that department. I heard that recently there was a death in your family. How can I help you? How are you going through? How are you holding the post? Invariably, majority of the doctors tell lie with regard to when you ask, how are you? Even if they are going through a tough time, they will smile and say, I'm fine. Very rarely, doctor says, I'm feeling sad, because they don't want to give up. Unfortunately, they are also human beings, and we do not support them, and they don't acknowledge. So whenever a doctor says, I am sad, I'm feeling burnt out, please give your time, because the best thing you can do is support a doctor, because by supporting him, he's going to look after many patients. That is the best professional dignity we can give, or a professional, whichever we are working, we can give back to the profession. Ask them about the person who has deceased, the relationship, what happened, how it happened, when was the last time they met. Because in the first case which I mentioned, the lady, when she broke down, the problem was she had met her father 1.5 years back. And after 1.5 years back, when she went to her hometown, he was no more. So she felt very difficult to digest that. So although she was with her father for 35 years, but the last 1.5 years, she could not meet him, talk to him, and he could not see her. So the circumstances about the death. And now we have to talk about the quality time spent between the deceased and the lady, the doctor who was lost her father. That's very essential. How it happened, when, who were there, whether she is feeling responsible. This is the another issue. She feels, in this case, she feels responsible for her father's death, because I'm being a doctor. If I was there next to him, she feels she could have helped him. There were doctors in the ICU. They could not help the father. So she believes she could have helped. So that's where the problem of thinking comes. Sometimes in the third case, where the doctor was assaulted, he started blaming everyone, telling that I did my best, but the people were assaulting me. So invariably, we have to allow that pent-up emotions inside the mind has to be allowed to come out. It is just like a pressure cooker. It needs to come out. If it doesn't come out, we are going to see a lot of mental health morbidity. Facilitate ventilation. Ventilation means allow them to talk. Suppose one more example I can give you is, imagine if your friend is going through a tough time, you as a friend go and talk to him. He will pour out all his problem with you. He may not do it to anybody. It's just not because you are going to give solution. You are giving your time. Since he's able to ventilate, that basically if you look at the brain functioning, the frontal lobe is the one which thinks, executes. Amygdala is the place where maximum emotion is there. Whenever the maximum emotion occurs in the amygdala, the frontal lobe thinking hijacks. That means he can't think. At the fit of heightened emotion, the thinking process stops. That is the time when the crime occurs. At a fit of an anger, he can't think. The amygdala starts firing. He commits a crime. Another, for a small joke, at the height of a person who is in love with some girl or a boy, the amygdala and the limbic system is firing. He can't think. He runs away from the house and gets married. After 2 or 3 weeks, the emotional component comes down. He starts thinking, what did I do? Why did I get married? So these are the processes which occur. So that is the reason we have to allow them to ventilate, so that the amygdala firing decreases, frontal thinking process takes over. So inquiring about the emotion and paraphrasing is very essential. And we need to normalize the emotion. You have to tell, yes, if I am in your place, I will also go through the same situation. Validating the emotion, and you have to say you're not going crazy. This is a normal phenomena everybody will go through. That around 1 or 2 sessions will help them. And follow up, talk to them, and invariably sometimes you have to tell them, if that lady was given an assignment to write a letter to the father, telling that what would have happened, how it happened, and how she feels sorry for it, she can write it. She may not be able to post it, but just to write so that she verbalizes into the letter, she may tear it off, or else she is able to come out and plan. And so planning next day is essential. So these homework assignments can be given in the second case, especially for the granddaughter. Here, we have to put the photograph of both the father and mother, and we have to do a group ritual. They need to cry so that the child also cries, and they accept the death of the son so that the granddaughter is able to accept, yes, my father is no more. Sometimes we have to bring in open chair technique. Tell the granddaughter to imagine on the chair her father is sitting or the mother is sitting, talk to them so that the grieving process starts. Role play. If your father was sitting here, what would have said to you? So the father would have said, I have forgiven you, my child. So that comes the cognitive restructure, thinking restructuring occurs. So these are the role plays. Sometimes the child may want to do a drawing. We did this in various of this, even Uttarakhand disaster. One of the village in Pulwama is completely wiped out. There, when we talked to the children, was not able to talk. When we able to talk about the disaster, when we gave them the crayons and the paper, they're able to do the drawing of the disaster, and they are able to explain that I saw my friend's father washing out in the river. So they are able to verbalize it. Otherwise, they find it very difficult. Sometimes you have to use photo albums and ask the child, see, what is this photo? Where is your dad? Where is your mom? What was the situation you took? Then the child start ventilating. That is what is very required. If there is a videos of the deceased, to go through the situation and to make that emotions to come out. Crying is normal. Crying is not weakness. Crying is ability to feel the emotion. That is what is very essential. So those kinds of assignments has to be done with your colleague. He's a doctor or he may be even a nurse. I told about writing the letter, sometimes using the art. Art is basically dance. It may be various other art expression can be used to ventilation, to come out, to whatever the thoughts or emotions are there to come out. Just one example I can give you is, it may not be COVID. The last moment with your dad, you would have fought with him and he died. Or you would have fought with your mother and she had died. Now you want to say sorry, but you are carrying that burden till date. So now this is the way to see and to grieve. Do something in the honor of the deceased. That means if in the first case where the lady felt that she would have been there, the father would have alive, the father used to do social work. Now she started doing social work so that in the honor of the father, she feels that she's repaying the debt. And the father had some unfinished tasks. She started building the one small school his father wanted to build. Now she has taken up the task to complete the school. So this kinds of what we call it as rebuilding the whole, whatever the happened in the COVID to be done. So finally, tips of grief when you do or when you are going through, active listening is to be there. Allowing for the person to emote. That means they should be able to cry. Don't stop them crying, because unless it comes out, they will not heal. The way I would rather put it across is, whenever there is an abscess, you have to cut incise so that it comes out. Then the healing occurs. Similarly, in case of grief, there is an emotion which is pent up, which has to come out. That is by verbalizing. If it is done, the healing process occurs very fast. Otherwise, the healing takes very long duration. Normalize the emotion. Feeling guilt is normal. Feeling that becoming angry oneself is normal. Validate the survivor's feelings. So the person who I told about Andaman Nicobar, the electricity board person, I said, if I was in your place, I could have also not saved your children. If they were my children also, I could have not saved. That means the waves were so strong, nobody can do anything. So you have to remove the survivor's guilt. Encouraging the grieving process, symbolic ritual is required. Hence, on the one day, the government made a day where they went and grieved and let going occurred. The grieving means a mass ritual was done. Accept your emotion, structure the daily activities, don't block the emotions, don't preach, be strong, you are a man, you are a woman, you are a very strong lady. No, we are all human beings. Some or the other day we have to grieve, we will feel sad, we will cry. It's normal. It's normal to cry. That's what is called as normalizing. Forget the deceased, don't say that, because the death would have physically removed them from this world, but emotionally still they are connected. Stop talking about the deceased. Don't tell that. They need to talk, then only it will be easy to go away. Avoiding discussion about the person who has died, don't do that. Discuss so that it becomes a normal process. So finally, this is one of the simple way of remembering whatever I have told is Ivan therapy. That is, Ivan means God is gracious. E means inquire emotions. If your friend or if your colleague who have gone through a grief, ask, inquire, how are you feeling? He may say, I'm fine. Talk to him and say, how are you able to hold the post? How are you able to work? Whether you are able to concentrate. Validate. If he talks about feeling guilt, I have not done this enough to my family, validate. It is same, most of the doctor feels that, validate. Ask them to accept the emotion. The way the emotions are coming, accept it and normalize it. Normalizing means crying, anger, they're all normal. So once you normalize it, you are able to accept it and it goes. So this is Ivan, that is hashtag Ivan therapy. So you will be able to remember, you can learn these 4 steps easily, spending around 10 to 20 minutes for over a period of 3 or 4 days. The same doctor who was there working with you will feel better and will start working. So appropriate referral is required whenever there is attempted suicide, severe depression, not able to come to work, substance abuse, alcohol is there. Immediately they need to be taken to the mental health professional for treatment. The only cure for grief is to grieve. That means there is no other shortcut method. They have to grieve, then only they will be let going that person. Thank you very much for giving your valuable time. And whatever I have presented, it is available on the social media Suresh Bada Math. So you can find these videos available. Over to the organizers.
Thank you, sir. Thank you so much. That was a very helpful and very educative session. So now we'll move on to the next part of our session, that is the Q&A session. Okay. So can we start with the session, sir? There are a few questions. Okay, right. So the first question is, what is the best way to break bad news to the relatives of the patient who died due to COVID?
Okay, so this is, this is one of the very difficult scenario because breaking bad news is not taught in MBBS. Okay, even in MD, psychiatry, also MD medicine, we don't teach. Only in the oncology, they teach about breaking bad news. That is, we know in person. In person means if somebody has been diagnosed as cancer or somebody has died, we know how to communicate bad news. Unfortunately, many of them of our doctors are not trained for that. How to break bad news, even in person. Now we have to do in person is very difficult because the person is admitted in the ICU or somewhere else and the family member stays somewhere else. So communicating them is very difficult. So in COVID, it has become a big challenge. Hence, they say use virtual medium to communicate bad news. Invariably, the classical teaching, there are various protocol. One is Spike protocol is there, then the ABCD model is there. So in this model, what we have to do is, I can give you a classical example and you have to adapt yourself to your scenario. Whether you are in ICU or you are working in a different situation, you have to have this breaking bad news protocol. The breaking bad news in this, what you have to do is first understand the scenario. What is the how the death has occurred, who knows about the case properly, and that person should be available. Call the family, take them to a place where there is enough of space to communicate the bad news. That is I'm talking about idealistic way. Many a time we do not have this ideal way of communicating. The best place is take them to a separate place where the lot of space is available. You have a security personnel, if it is there, it is very good. And ask them, telling that what do you know about the person's condition? Who was the person who is communicating with the treating team? Because invariably in India, what happens is Mr. X is admitted Every day one person comes. Mr. A will be talking one day, next day Mr. B, Mr. C. So who is constantly available with the treating team should be allowed to talk, and he has to tell what we have spoken to them and what they expect. And next you have to tell them, would they like to know everything or they would like to know very little. And now you have to communicate. And before you start discussing, you have to give a hint that we are going to talk a bad news. We are going to break a bad news. Then you have to give and tell them directly that the person has died. Don't say he passed away, or else you don't say he went to heaven. Don't do that. You say the person died. And this is the scenario it happened. So immediately there will be a grief, there will be shock, there will be denial by the family members. They may become angry. So that is the time you have to have a CCTV in that corner. Everybody will restrain from their behavior. So that is the way to break the bad news. But unfortunately, many a time we have not been trained. Many a time they shout at you. So at that time, you have to stay calm. Do not defend yourself immediately, because by trying to defend yourself, you are going to get into a tussle. And if the mob's built there, that means mob mentality. We call it as mob psychology. That mob psychology is driven by many people's thinking. That is the time violence erupt. If that is going to erupt, please don't be there. Any amount of rational thinking is not going to work in mob psychology, because unless the mob is dispersed, the mob psychology is a different psychology than individual psychology. It is easy to calm down one or two people. If there are 7 or 8 people are in violent, there is no point in doing counseling or trying to engage them in discussion. So you have to be very clear. You have to discuss the bad news only with the people, with the family members, 3 or 4 members who are very clear, and give them the information, and then the process has to be done. Over to you, Dr. Prashant.
Yeah, thank you, sir. Coming to the next question, so it is from Dr. Atul Gurgaon. So doctor wants to know how important is meditation and how beneficial is deep breathing and muscle relaxation to reduce the severity of grief.
Okay, see, every person, as I mentioned, every person has a different way of grieving. One person would like to talk to the friends. Yes, one. Another person would like to go to temple and grieve there in silence by meditation. Another person would like to go because the father used to like orphan children, used to go there, go to orphanage, and he wants to spend time. Everybody has a different way of grieving. It can be yoga, it can be meditation, it can be bhajan, it can be dance, it can be singing. Every person has a different way of grieving. So we have to respect the grieving process, and we have to allow them to grieve. Anything which allows the inside ventilation to come out. The best example I told you, the pus is collected inside the body. We have to put the incision. If you're asking, you have to put a crisscross incision, direct incision, or what kind of incision? So it left to that kind of way. So what is best suited for that kind of abs? Similarly, that person, we have to do that kind of healing process. So there is no any right way or wrong way of grieving. It is only when a person decompensates, he is unable to go through the grief, unable to accept there is a death, unable to accept that the person is no more, and I have accepted, but the emotions are there. My father died around 10 years back, but I still feel that he is with me, but doesn't mean that I have accepted his death, but the emotions still are what we call it as alive, and it will be there till the last moment of my life. So that has to be accepted. So that is where whichever way it is there, and he is able to do it, it's fine. It can be yoga, it can be Ayurveda, it can be anything. So the grieving has to occur. That is the process.
Okay, thank you, sir. So there is one more question from Mumbai. So this is Dr. Vishnu. So he is asking that how to stop the crying spells. So he wants to know more about the crying spells and how to stop them.
See, if the crying spell is occurring as a doctor, I would rather allow him to cry. The reason is very rarely the doctor cries, especially the male doctors. Many of our male doctors do not accept they are feeling sad, and very rarely they break down in front of their friends. Very rarely, if you ask me. So if they cry, allow them to cry. If it occurs repeatedly over a period of maybe 1 month or 2 months, it is accompanied by severe feeling of sadness. Smashana Vairagya, more than 2 weeks. That feeling of philosophy, what is there in world? Why should I be alive? I should also die. If he's talking that, that means we are entering into a depressive mode. He's being excessive fatigue is there. That means even after doing a slight work, he becomes tired, unable to feel the pleasure even in day-to-day activities. When if I'm depressed, even my child comes to play with me, I become angry with my child. That means slowly depression is picking. Look, seeing a good video or talking to parents or having we chat with the friends do not give that pleasure. That means loss of pleasurable activities. That means he's entering into depressive mode. That is the time the medication is required, and either SSRI, that is selective serotonin reuptake inhibitor, should be started. Nowadays, there are amazing SSRIs are available, like simple medicine like escitalopram, which is almost equivalent to that of a paracetamol side effect profile, is available now. That can be started over a period of 3 to 6 months they have to take, because invariably we are talking about a disorder of the brain, similar to the kindling effect of epilepsy. Once there is an epileptic seizure occurs, there is a kindling effect occurs. So we start anti-epileptic to stop the seizure, and we continue over a period of 1 to 2 years so that it does not relapse. That is prophylaxis we give. Similarly, in psychiatry, we give medication to overcome depression over a period of 1 to 2 weeks or maybe maximum 4 weeks. They are recovering. Don't stop, because there is a high chance of relapse. If you stop the medicine within 1 to 2 months, the relapse rate is 50 to 60%. So don't stop. They have to take a medication over a period of 6 months, and slow tapering has to be done over a period of another 3 months. So one course of depressive episode means 9 months medication has to be given. So that is the way, because it is nothing other than a brain disorder where there is a neurochemical imbalance. Either the serotonin is decreased, various other norepinephrine is decreased. So various, not only at the hormonal level, now we are talking about the second messenger, third messenger, and also at the receptor level, and gene expression, which is seen, especially at the level of hippocampus. We can see the depression has a direct impact on the brain. So the medicine is required at that time. And please don't stop if the doctor is crying, but you should know what is moderate. Yes, he is able to cry. First time he's crying, allow him to cry. No problem, give time. But if he has a classical depression, take help. That is the time you have to refer him, and the medicine has to be started. Over to you, Dr. Prashant.
Yeah, thank you, sir. So there is one more question. So it is regarding the children. So during COVID, a lot of children have lost their parents due to COVID, and counseling them has been a challenge. So can you help or give some tips on those points?
Yes, Dr. Prashant, this is, we call it as COVID orphans. We are now the names have been termed. Invariably, the numbers are huge. And if you ask me, there are around 3 crore children are waiting for adoption, not really related to COVID. They are already abandoned in our country, because either they are abandoned or they have lost the parents before COVID. 3 crore. Along with this, COVID has hit another ceiling now. We have huge number. We don't know the numbers now. At least one parent has died, at least around 2 to 3 maybe lakhs. We don't know exact numbers. I don't know, but the numbers are increasing. If the 2 parents are also died, now the question is how to help the children. Children, they have the brain plasticity is amazing. If you ask me, that is neuronal plasticity. If you give a right environment, they bounce back. If the adverse environment comes, they get degraded. That is what I would like to put it across. What is the best environment? Now, if the parental figure has died, both the parents have died, now we have to replace with the other parental figure. Maybe their other family members adopt them or they take them. Now the question comes, should we allow them to talk? Don't force the child to talk, because child will not be able to express their emotion. What is the best way to express their emotion? To bring those albums, discuss about their parents. That is the best way. Don't avoid talking about their parents. They are their parents. The child remembers them. Telling them, forget about your parents, it's not going to happen. Simply, it's not going to happen. So again, depending upon the child's cognitive development, that is brain development, if the child is less than 3 years, it will not comprehend that what is death, less than 3 years. 3 to 6 years, the children will think It is like a comedy. When the child between the age of 3 to 6, it looks at the Tom and Jerry. The Tom and Jerry is the cat dies, and after 5 minutes it resurrects. It falls from 10th floor, and it again gets up. It thinks that parents have gone, they will come back. That is the way they process between 3 to 6 years. Anybody after 6 years, they process like a normal adult. So that means we have to respect them, and we have to allow them to grieve normally as possible like an adult, and you have to give them space, allow them to talk. Don't avoid talking about them. Keep the photographs at home, and if possible, if they, like in many families, they keep the dead person's photograph in the worshipping place, so every day they do puja. That is the time they start grieving. Sometimes they feel that the children have a magical thinking. Since I did not had milk on that day, my mother died. That magical thinking will be there. So the child has to go in front of the photograph every day, and in its own mind it says, sorry mom, I did not drink that milk on that day and you died. So that has to happen. If it happens, then the family members, others should allow the child to discuss what is happening in their mind. It can be writing a letter to the parents. The child may write a letter, or else it may be even typing something, or else having a role play. Like if the father's chair is there, ask the child to talk to the chair, imagining the father is sitting there and how the father will react. That is what we call it as role play. Old photo albums, bring that, discuss how it happened, what happened. Don't feel bad. You being an adult, see, there is a death in the family. You are an adult, you are also grieving. At the same time, there is high possibility you may ignore the child. First, you have to take care of yourself, and then you have to provide care to the children. Unfortunately, in the grief process, we forget the children that they too also grieve. So we have to provide an opportunity, give time, allow them to, in their own way, to grieve. It may be painting, talking to them, or visiting the place where the parents have gone for a trip. Go to that place. So the child will say, on that day we came here, we spent time there. So that if they are able to speak about the parents who have died, normalize it. The emotions come out, and the child knows that, yes, the parents will not come back, and then the child will start rebuilding the life again. So there are various ways. So this is the one simplest examples I have given. So sometimes if it becomes very difficult, invariably we may require child psychiatrist or child psychologist help. Over to you, Dr. Prashant.
Yeah. Thank you, sir. So now we come to the last question, because there are a lot of questions, but as we have already crossed the time, so I'll take the last question. So the question is, whatever families you are talking to, some are having suicidal tendencies. So what is the next step and how to deal with this?
See, if there is a suicidal tendency, in psychiatry, we call it as an emergency. They need to be immediately given help. They need to be immediately referred. And there are steps whenever there is a suicidal ideas are there, attempts are there. Immediately the person who is there should be with them until the help arrives. Don't leave them, because invariably it is a fraction of moment they attempt. So invariably you have to be with them. And sometimes you have to call the family members who care for them, and they have to be taken to the nearest mental health professional, maybe psychiatrist. Sometimes they require medication. Sometimes they need to be admitted. Don't ignore a suicidal ideas or attempt, because it is the desperate cry for help. It is not that the suicide is a solution. The suicide is a measure of escaping from the suffering. That means we have to ease out their suffering. So invariably, whenever there is a suicidal ideas, sometimes in your own family, the child may say, wish I would have died, wish I would have not born in this family. That means something is wrong is going in the family, in the environment. You have to talk to the child. If you are a doctor and your child is speaking these words, start spending time with the child. Don't give lecture. That is another big mistake. We as a doctor start telling, oh, this is at your age, I used to do like this. That's not, the child doesn't want that lecture. Be a child with your child. Allow the child to speak. Allow the child to ventilate. and your words should be as minimal as possible, as the nature has given one mouth, 2 ears. That means if you are going to spend time 1 hour with your child, the child should speak 40 minutes and you have to speak only 20 minutes. It's not the ulta. That means you have 2 years. That means 2/3 of the speaking has to be done by your child, 1/3 is by you. So it should not become you're speaking and the child listens. That's not the way. So you have to allow them to speak, ventilate. The child may not speak immediately. You have to spend time. It may be 5 or 6 times when you start daily walking with your child, the child starts speaking slowly, one after the other. Don't judge the child. That is another biggest mistake we do. How can it be possible? Don't do that. It can be possible. Oh, it's going through that. Okay. Oh, how has it happened? Can you explain me more? So open-ended question, non-judgmental, the child starts speaking. Over to you, Dr. Prashant.
Okay, thank you so much, sir. So here we come to the end of today's webinar. And on behalf of Sun Pharma, I would like to thank our esteemed speaker, Dr. Suresh Math, for sharing his enormous experience and providing valuable practical tips, which would surely help us to take better self-care and provide effective patient care. I would also like to thank the valued audience for taking their time out this evening and honoring us with their presence. At the end, I would also like to thank our entire backup team for their kind support in making this event possible. And before I forget, I'll just tell about our next webinar. So I invite all the doctors and their family members for the next webinar, which is planned on 31st July, that is a Saturday. And the speaker for this session is Dr. Ajit Bide. The topic for the session is the silent hazard burning out in the pandemic. And the timing is 7:30 to 8:30. So we'll meet over there for the next week. Till then, I'd like to thank you once again, everyone, and stay safe. Thank you.
Stay safe. Thank you very much, everyone.